Welcome to the Holistic Kid Show. My name is Dane.
My name's Abdullah.
My name's Iman.
And my name's Abdullah.
We're the Holistic Kids here to educate and empower us kids from the inside out. Among U.S. high school teen students in 2023, 40% reported persistent feelings of sadness or hopelessness in the past year. 20% reported serious considering attempting suicide in the past year, while 16% reported making a suicide plan in the past year. 9% reporting attempting suicide in the past year.
But today we have the perfect person to talk to with us today. Dr. Noor Jihan Abdul-Haqq is a board-certified integrative pediatrician from Oklahoma City. Dr. Abdul-Haqq is completed a pediatric integrative medicine fellowship through APIM recently, and she was also honored as a healthcare hero by the Journal Record. Dr. Abdul-Haqq, or Dr. Jihan, has been interviewed numerous times on local radio and TV and print media. We are so thankful to have her to join us today. We are so honored.
Thank you. I'm honored to be here as well. You guys have been doing a lot of great work out there, and so it's definitely a pleasure.
So just to start off, tell us your story.
Oh, my story. So more of like what made me become a doctor or what made me become interested in integrative medicine.
So how did you go from a doctor to being interested in integrative medicine?
Right. So my journey actually began with my son. He had horrible eczema at 3 months old and would actually bleed when he would rub against people's clothes or things like that. And he couldn't sleep or anything. And so that set me out on the journey to figure out what was causing his eczema. Later, we found out it was food allergies, but he still wasn't getting better. So we realized we had to improve his gut health, amongst other things. And so that is when I started to get more into homeopathy, using herbal products, and also just really looking at how do we heal the gut through different modalities. And so that's what initially put me on that path. Well, later on, I actually started to do more with mental health. And COVID, I tell you, I started to suffer from my own anxiety because I run my own practice. I'm a mom of 3, and I was trying to figure out how to also not to get my parents sick, but still be able to see them. And so that is when it took me even more into what are the things that I can do to not only, of course, the COVID stuff, but my own anxiety. How can I heal myself? And without necessarily taking medications. So yes, there are things like therapy, and which is cognitive behavioral therapy and other things that people can do. But I realized that there was something different with me. And so I went on my own journey to heal my own gut and also look at some different modalities and things that I could use to help my own anxiety, which I started to implement with my patients and saw great improvements. And so that has kind of kept me on this journey, especially with mental health and integrative medicine.
That's amazing.
Amazing.
So, like, what are these? Like, can you tell us, like, some of these?
Can you tell us about what you see in your clinic, especially regarding teens and mental health? Because I know in our high schools, it's become really prevalent, and I think compared to like our mom's time, maybe even your time, it used to be like almost non-existent, or at least not talked about.
And that's the thing. I think it was there because I do recall, students, who were really struggling, and sometimes it was just brushed under. But I do think so much has changed because of social media and access to phones and tablets and all of these things. And so it really changes how your brain is reacting to different stuff. So take, for example, we used to watch Mr. Rogers' Neighborhood. If you've ever seen it, it's really slow and moving, and we all enjoyed it. But then the next generation, it was like Animaniacs, and it was like, da, 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 da. And the kids, they actually did studies where they actually looked at MRIs of children watching the 2 different shows, and it showed this rapid firing. And so just imagine if every day your brain is just overstimulated, and then you have to sit in the classroom. Well, what do you guys do? Someone's teaching on a board and they're like Mr. Rogers, right? Of course, teachers are trying to be more innovative and exciting, but the reality is that real life, it's much slower than scrolling and all of these other things. And so your brain is trying to figure it out, because every time we see the little kids scrolling and teenagers, you're getting this increase in in something in your brain called dopamine, right? It makes you feel good. And so you're like, let's go to the next thing. But the problem is you also might encounter like some doomsday, posts or some other things, right? And then your brain is like, whoa, no, now I'm sad. Oh, how do I feel about these things? Right. And so it creates what I'm seeing in my patients, a lot more stress and anxiety. And when I ask them to take breaks from social media, from scrolling, their brain gets to rest and they actually sleep better. They're not having as much anxiousness. And their stress is actually reduced and they can focus better. And so it's crazy to me how things have changed just from little simple things as scrolling with your finger and what you watch on TV.
And you're like 100% right. I mean, the
Yeah, so
environment now has changed so much, and it's affecting teens like it's never have before.
Definitely.
Because teens all around the world now, especially in school, we can see it. They can't stay in the class and just listen. They're all over the place. They're throwing things. They're getting angry for no reason.
Yeah, I need something to stimulate them.
Yeah.
No, definitely. And I see that especially in right now, the 5-year-olds and the 6-year-olds. I've had patients who'll throw a desk, like they'll throw anything. And those are those kids who were their COVID babies, what we call them. And what we've noticed with them is that they didn't get a lot of stimulation from outside. They were indoors. A lot of them were just on screens all the time. And they're really struggling with how to communicate with others and social relationships. And so they just hold it in and then explode. And we see that, of course, with teenagers. I'm sure you all have experienced that, where people just bottle everything in and they don't communicate and they don't talk about it until it just becomes like an explosion or aggression. And for some kids, it also can look like I'm holding it in. I may not become aggressive, but instead now I look at substances or I look at other things to out, and you have some retreating even more. And the statistics that you gave, obviously, about suicide are increasing. Some of these are still increasing because the reality is that we don't communicate face to face anymore. It's all on digital, and people also are bullying and they can't escape it. I always tell people, when I was a student, when I went home, you had to call my house, right? To get in contact with me. Now people are in group chats having conversations about other kids or things that happened at school. So if something embarrassing happened to me, like it was done with, and the next day most people forgot about it. But with you all, something embarrassing, it's live, it's on TikTok, it's everywhere. And it's just so hard to be able to escape a lot of this. And it may not always be malicious, when people are posting this stuff. But just imagine if you're just constantly bombarded by the video of you doing something embarrassing and what that can do to your mental health. And so it's very important that teens and young children, it's not just teens who are on these things, right? Mm-hmm. Realize that when you post, how it's going to impact someone else, similar to if you had to call their house phone and talk to them or say something, because our actions, sometimes we can't retract those things. So we have to think before we act, because we could really cause harm in someone else's life.
Mm-hmm. Definitely. Social media can be a very dangerous place for like people all around the world. And that's why, but it can also be very helpful. So learning how to manage that is really important.
So you mentioned earlier on how people bottle up their emotions, and we that's like for teens, that's like common knowledge. Like most teens, if they're going through something, usually sadly, they're not going to tell anybody else. So maybe as a parent or, as a friend, how can you recognize early signs and recognize someone struggling and actually go and try to help them?
So one of the things that I often tell parents is to look for a change, right? Is your child in their room more often? Are they not wanting to eat? Are they not coming out? Are they having conversations with you? Are they staying up much later? Are you also seeing changes in the classroom? They're not as motivated. Like they don't even want to, they're not turning in their homework, the easy stuff, right? Or maybe they're not doing as well on tests. Those can all be red flags telling us that your child is struggling. And sometimes even us as parents, we're so distracted that we fail to notice it. But I'll give an example. A parent recently was talking to me and they were saying how they noticed that their teen didn't want to go to the football game. And their teen always wants to go to the football games. And then the next day they were sleeping in. And so the parents said, I realized I needed to check in on them. Come to find out that teen had just gone through a breakup, didn't want the parents to know they were dating somebody, this whole thing, right? And so those are some of the things we want to look for. As a friend, is your friend say, I don't want to go anymore. Oh, you guys go without me. I'm just going to stay back. Pay attention to those things if that's a change in their behavior. but also just check on them, even if they're not wanting to go, to make sure it's not, hey, I don't want to go because the person you guys are going with isn't nice to me or isn't kind to me, or I don't want to be around that person. So even as teens, I know it's hard because you guys don't talk that much. You like to text. Even text your friend, okay? Have that conversation, and just check on each other as often as possible. You okay? Well, you guys say, you okay, bro? Right? That's what you would say. Just to make sure. And I know that people are like, who does that? But I'm like, I wish more people would do that, because a lot of times just that little statement, your friend might say, nah, I'm actually not, or I'm okay. And then that helps you to be able to say, you may not become their therapist, right? You're not becoming their therapist, but you can say, hey, you want to go to the movies with me tomorrow or something, right? And so you as a friend can also help your friend, and maybe they'll come out and say a little bit more, but it's okay if they don't. Just be there for them when you notice they're going through a difficult time.
So I know it seems like an easy question. It seems simple, but for teens that are in families that don't really prioritize mental health, like I know in like Muslim families especially, I know a lot of teens around me, they don't want to talk to their parents because they're scared of their parents. And maybe in other families, Arab families, and just the different cultural norms. For teens in those situations, what would you say to them to help them, get help and be able to talk to somebody?
So a lot of times my approach is different based on culture. You nailed that, because culture is important, because sometimes you don't want to overstep and you don't want to dismiss people's cultural norms. But a reality of children, especially in America, who are children of immigrants, they're not living the same lives that their parents lived. And so their parents don't quite understand. So sometimes for these teens, I tell them to write things down. If you don't feel that comfortable approaching your parent, can you write it down and just say, I feel this way? It's like journaling, but you would share it, right? And for some children, that does work. Others say, I don't think my parent's going to understand. And that's when I come in as a pediatrician, and I actually will schedule an appointment with the parent to better help the parent understand what the child is feeling and what they're going through. Because it's very unfortunate that so often mental health is just pray about it, just pray about it. And yes, we should pray about it, but we also have to figure out what's causing it. And sometimes the cause is something that we can fix ourselves. And often that might even be revealed through prayer, but we ignore it too. But it's just really important that we are doing both things and communicating as well. And I will say, as Muslims, right, we have an example of our Prophet Muhammad sallallahu alaihi wasallam, and he was actually, an example of communicating and spending time with children and playing with children. Those are huge examples of showing us that those children felt comfortable speaking to him. So technically, despite our cultures, if this is our religion, we should make sure that we're all playing with children, having conversations with them, and making time for them.
Yeah, that's amazing. And there's a lot of wisdom that's coming out nowadays, especially in the religious aspect. But I know so many people, they forget the actual physical aspect when it comes to medicine and health.
Yes.
Because even like you mentioned, the Prophet ﷺ, he meant there's so much wisdom. And he even went to go see a therapist, or when they had disputes and stuff. And he used to go tell people to go visit other people of knowledge and in their experts in their professions. And I think that's so, if you have a problem now, you just go to a sheikh and expect it to be fixed.
Right. And they're no longer, most of them aren't trained to be able to handle some of these things. They just have necessarily Islamic knowledge. But the social aspect is important. And it's important too that we are training them to be able to handle more social issues as well, if you're going to be a leader. And so that, because people are going to come to you. And I know that personally, when I used to live in another city, my imam was actually a certified counselor and therapist. And so it worked out very well, because we had a wonderful advantage where you could go to him and he actually had both sides of the knowledge. And so that, to me, would be amazing, if we added more of that. And that's not just with Muslims, that's with other religions as well. Like, if these are the people that people are often seeking help from. And so not that they have to be experts in the field, but just some basic knowledge so that they're able to help people, and then also be able to direct them to the proper people to get more assistance. Because I know I've actually had a young man in my office who was maybe only 12 or 13, who was only going to his pastor, and he was sending him emails, and the pastor did not see them. And he was telling him that he did not want to be on earth anymore. And the pastor never saw it. And then when he finally did, he was like, oh my God, what do? I don't, necessarily know how to deal with this. And so, they ended up calling out outside resources. But what if he had actually been a little bit, trained to deal with that situation, to help him right then and there as well? It might have de-escalated some of what ended up happening later with that patient.
So right now, I know especially in teens, there's a lot of anxiety in teens, and it's continuing to rise. And the difference between anxiety and depression, especially in teens, is that depression, it's sometimes more visible compared to anxiety, which a lot of teens, they just say, well, let me just live with it. So for a lot of teens out there, maybe even parents, is the anxiety treatable?
Most definitely. Anxiety is treatable. It's actually one of those things that you said that's difficult sometimes for us to see. And people often think it's just ADHD or other things. They always label anxiety as something else. And I'm always like, it's anxiety. And so being anxious is a normal part of being human, right? So our body tells us at some point to be fearful of something so we don't get in trouble, right? If you see a cliff, don't jump off of it, right? It's telling us to pull back or to be afraid of that edge. However, when it starts to affect our daily life, our behaviors, things that we're doing, then it's more of an anxiety disorder, okay? So with anxiety disorders, they actually respond very well to therapy. But as an integrative pediatrician, what I have found is that so much of our anxiety is associated too with our diet. And so many teens love caffeine, adults too. People are drinking all these energy drinks, and I'm not going to say any of the names of the drinks, but all these energy drinks and all these other things because they don't sleep well. So they don't sleep well. So therefore they drink these things. Well, the drink makes them more anxious. Poor sleep also makes you more anxious. And if we improved our sleep, we stopped drinking some of those drinks, and then we paid attention, as I mentioned earlier, to what we're consuming during the day, then it lessens a lot of the anxiety, especially what I call rumination of thoughts, right? Just going over and over and over those thoughts. Because the reality is that sometimes you will have to get training on how to stop those thoughts, or what I say, weighing the thoughts. For example, someone is afraid to eat in the cafeteria, right? We have to figure out, well, why are you afraid to eat in the cafeteria? And they may say, well, one day I was eating and I accidentally spit on some people and they made fun of me, right? So now I don't want to eat in the cafeteria. So there's a reason, right? And so then we have to figure out, okay, how many times did you go to the cafeteria and this happened? Well, it happened once. How many times you've been and it didn't happen? Oh, the majority. Okay, so what's the likelihood of this happening again? It's not that high, but how did it make you feel? Baby steps and kind of walking people through it. And that's one of the ways to really help with anxiety, and of eating a really balanced diet. And there are lots of vitamins and minerals that many of us don't get in our diets today, just because our food is just not as what we call nutrient dense. It doesn't have all the nutrition that it used to because our soil is just, overused. But then also there are so many foods, a lot of these packaged foods and processed foods, which you all know because you don't really eat them, that affect your gut and then affect your anxiety. And especially a lot of the gluten and the carbs. And I do find a lot of my patients who are anxious are doing a lot of sugar, a lot of crunchy foods and pastas and noodles and all these chips and things like that. And when I can get them to eat more of the fresh fruits and the vegetables and some nuts and seeds and things like that, where they're getting more magnesium and they're getting zinc, omega-3, then we start to see an improvement in a lot of their moods. And so it's been very interesting to me to see how much nutrition impacts our mental health.
Oh, you're so empowering.
So empowering.
So talking about nutrition, how does what nutrients help how we to give a balanced emotions?
So some of the ones I mentioned, right? So magnesium, zinc, omega-3, vitamin D, and our B vitamins. Okay. So all of those different vitamins and minerals actually play a role in the production of what we call neurotransmitters. such as serotonin, dopamine, and norepinephrine. And those are the things that help control the signals of our brain to help with mental health. So for example, magnesium is often used in a lot of these, aspects, but someone who's low in magnesium may not make the things that are necessary to get these neurotransmitters. So then you have less of it around. So then we may see things like depression or anxiety because we don't have enough of that thing to help. That's why you see people using magnesium to help. But it's also important to know, where your status is, what you're eating, etc. I personally like to take a food approach to many of these things because you don't have to worry about the dosages and did you take too much and what other medicine are you taking, etc. But when you eat the foods, your body naturally digests it and takes what it needs and you poop out the rest, right? So that's one of the things. But they're really important, these vitamins and minerals. And when we don't have them, I tell you, whenever people tell me what they eat and then they tell me what's going on, it's like, nailed it, right? And when I say, okay, well, can we pull this? Can we add this? Then we actually see improvements. I had a young man who had really bad anxiety, and we just added a lot of those foods that had magnesium and zinc and omega-3 in his diet and made him walk outside. And we were able to wean him off of his medicine. And of course, we limited the caffeine. But it's just important that we realize that those things are huge and in treating mental health disorders.
Yeah, our mom always tells us to have, zinc, magnesium, omega-3s, like you just mentioned. And I think it's been so beneficial for us.
Mhm.
Yes, and your broccoli sprouts too, though.
Yes.
Oh yeah, broccoli sprouts.
So, having fun with it also helps us with it. So, what's your favorite simple daily practice that supports mental health naturally?
So I think mine would just be stillness or mindfulness, just taking a moment to reflect on where you are now. And I am one of those people who my mind is always going because I have so much to do. So I have to make myself slow down and make my brain slow down. And when I do that, that helps decrease my stress and my anxiousness as well. So just finding time to be mindful. And for some people that can look like prayer, but I always tell people prayer and mindfulness is a little bit different, right? Because often you're focused on a different thing when you're praying. But if you can just sit and relax your mind, right? You're not trying to think of something else. You're just focusing on pretty much being in the present moment. And so if you can do that for, 5 minutes a day, starting, some people, of course, can do it a lot longer. But even 5 minutes, it helps to clear your mind and helps you to refocus your brain. And especially for children, if you can do that even before a test, right? And so that's going to calm your nerves. That's going to help you so that you're able to actually focus during your exams and things like that. And so it just takes 5 minutes, even 3 minutes for some people. But definitely, if you can get up to 5 minutes, it can be beneficial.
Yeah, and it's just so simple and so easy. Even 5 minutes a day, like you just mentioned right now, is just one of the most beneficial things you can do for yourself.
Yes.
So your podcast is called A Peace of Mind, and this was it
Raising Resilient Minds.
Yeah, Raising Resilient.
This podcast is called A Peace of Mind, or Raising Resilient Minds.
Yeah.
So what is your idea of why a peace of mind? Tell us more about that.
Oh, so Peace of Mind Pediatrics is my practice in Oklahoma City. And part of the reason why I named it that was because I wanted parents to have a peace of mind, as well as I wanted the children to have peace of mind. So when they come in, I wanted them to feel like it was a welcoming space, but I also wanted the parents to walk out saying, you know what, I feel relaxed. I understand what's happening with my child. I feel like we have a plan moving forward. So my podcast is Raising Resilient Minds. And the reason why I started that was because I realized that so many of our youth today lack resiliency. And resiliency is one of the things that helps us to cope when things get difficult. And because so many children and youth are lacking these coping skills, they're having a lot more mental health issues. And we're seeing more of the suicidal thoughts and even those attempts. And so I'm hoping that the more that people realize that if we're building resiliency in children, then we're going to help them live fruitful and productive lives as adults.
Wow, this has been so amazing and so empowering. So, but if you can leave the audience with one tip that they can do today or right now,
Like
and
easy tip, something.
something that they can just like do right now, what would
A peace of mind.
what would you tell them to do? One thing.
I think the biggest thing I would probably tell people to do is to get more sleep. Focus on sleep. That would be not the easiest, but something that I think is so helpful. Rest, especially for growing children and growing teens.
That's amazing. You're so inspirational.
Oh,
So-
thank you.
So, wow, Dr. Jihan, this was amazing. We are so thankful for your wisdom and time today. So, where can people learn more about you and your amazing work?
So I do consults and things for people through drjihan.com. If they're in Oklahoma, of course, they can come to Peace of Mind Pediatrics. But I also have the podcast Raising Resilient Minds, which is on YouTube, Apple, Spotify, and they can tune in there and learn a little bit more.
Amazing.
So definitely go check out Dr. Jihan because she was amazing. We can't say how amazing she was today.
Thank you.
Now, time to recap Dr. Jihan's key points.
We don't communicate face to face anymore. Kids can't escape anymore. It is important to know that when you post, we need to understand that we need to think before we act, as our actions can cause problems in the lives of others, or it can help it.
Check on your friends as much as possible. Friends can help other friends. Be there for them, especially if you know they're going through a rough time.
Anxiety is treatable, but anxious is normal. But anxious is a normal part of reality. But whenever it starts to affect our daily life, it can lead to anxiety disorder. Our diets can contribute to our anxiety. And how we feel, pay attention to the sugar, artificial foods, and eat more fresh fruits and vegetables.
Vitamins and minerals are important for our overall health and wellness. We should get most of it from food, but the nutrients that are important are omega-3, zinc, magnesium, B vitamin, and B vitamins.
And it is so important to be mindful. As teens, we suck at being mindful. So just being in the moment, being present, thinking about what you're doing when you're doing it, what you're putting into your mouth, and how it tastes, how it smells, how it feels. Find time to be mindful. Focus on being in the present moment. In 5 minutes, that can be so helpful and help us refocus our mind. So like we said, definitely remember to check out Dr. Jihan's podcast. We'll actually be on her podcast later whenever she posts that. But check that out. It's called Resilient Minds. And we need this now more than Raising Resilient Minds. And we need that now more than ever. So thank you so much for that, Dr. Jihan.
Thank you for having me. I appreciate it.
It's our pleasure.
It's our pleasure. So thank you everyone for tuning in. Until next time, I'm Zain Sari.
Abdullah.
And I'm Imad.
Follow my family and I on social media, Holistic Mom D, and look out for our new best-selling book, The Teen Health Revolution, releasing November 13th. Kids need to learn from other kids. Please download our podcast on iTunes and leave reviews so other kids and families can benefit. We need to create a healthy future for all of us and the planet. Join us next week for another episode of the Holistic Kids Show, where kids are empowering kids.
Thank you, everyone.